sheep and goat paws. Almost this is a this disease is causing devastating effect throughout India, especially northern India, and is a malignant pox disease of sheep characterized by fever, multiple non-vesicular swellings on the skin and mucous membranes. And then sometimes it causes rhinitis, conjunctivitis, and respiratory distress also. The distribution of sheeppox and goatpox is almost identical. Almost everywhere you will be able to see these cases of these both sheep as well as goatpox. Although only one disease may be reported when virus spread into the areas. So suppose if there is a chance to spread both the viruses, at least one virus will be predominantly producing disease in expected manner rather than other one. So they reflect the host preference of the individual strains of Capripox virus. So it indicates the host preference, that is species tropism as well as host preference. In etiology, it is caused by the Capripox virus. All strain of Capripox virus, including those that cause lumpy skin disease in cattle. Actually, we are facing the problem now. So because of this Capripox virus, that's the reason we used to use our goat pox vaccine as alternate in view of inducing immunity against lumpy skin disease. So usually this Capripox virus will also replicate in sheep. So that means lumpy skin. Some strains are equally pathogenic in sheep and goats. There are certain strains, like for example, if you take Kenyan strains, which have the same tropisms towards both species, that means sheep and goats, but most produce clinical disease in only one species. So when you see the stages of pox lesions, generally we might have studied in pathology. So usually there will be a roseolar erythema formations, then firm raised papules with a zone of hyperemia around the base. So second stage. Then there is a vesiculations. That means you can be able to see the yellowish blister with pitted center portions in the affected area, like vesiculations. Then there will be formation of pus. That means pustular stage. Then the last one is thick red tennis scab. So there will be scab formations. This is mainly confined to udder and teeth. So when you see the both viruses, sheep and goatpox virus, so the most severe form is sheeppox only. So compared to goatpox, sheeppox and goatpox virus are mainly highly host specific naturally. Naturally, they are having host specificity, but the exception is Kenya, where sheep and goatpox, which affect both species, that means goat as well as sheep. Sheep and goat pox are highly contagious. Actually, so usually the pox viruses are having the natural tendency of spreading very fastly through the scab. So otherwise, when you have the direct contact, otherwise, even if you have a contact with the scab or the any fomites, it will be fastly spreading. That means contagious disease. So the imported breeds such as Merina as great as that means amongst the sheep, the Merina species is having showing high susceptibility to sheep pox. And young animals are always at risk. In Eve, the severe losses occurs if lesions present in udder. So suppose in Eve, if the lesions are present in udder, obviously the young ones will be suffered of from milking. So you'll be able to see the Lambmortality, so that the severe losses will be incurred by the farmers. The transmission mostly of inhalations from the scape formations, otherwise skin abrasions, also by stomachs. Sometimes the mechanical transmission by stomachs is sensibly wherever the fly populations are fly anines are there. So we could able to see the transmission of this virus through these flies also. So when you see the clinical signs, the generally the incubation period of sheeppox following contact between the infected and susceptible animal is almost between the range of 8 to 13 days. The infection is usually with the aerosol route. Obviously, it is aerosol route, but virus can also be spread mechanically by the insect bite or experimentally by the intradermal or subcutaneous injections, in which case the reaction can be seen at the site of infection within 4 days. So sometimes even unknowingly, if people go for vaccinating animals, if they use the single syringes, sometimes are holding the animals and again holding the animals without gloves, everything, then still there is a chance to spread the virus to the susceptible stock. Lambs, so usually the malignant form is more common. So signs of depression, high fever, especially fever will be noticed up to 40 degrees Celsius, and discharge from eyes and nose. Then they commence as usually they commence as papules, then become nodular, vesicle, pustular, finally the scab formations. So especially the mortality, if you see in sheep, you can expect up to 40%, that means 50%. So the detected temperature may be going up to 40 degrees Celsius. Then macule, so especially the macule will be observed, the groin or axilla and perineum region. Then the papules, especially nose, eyes, mouth, mammary glands, vulva and prepuce, Then they used to quickly ulcerate, leading to rhinitis, conjunctivitis, phlebitis, and a secondary mucopollulant discharge as well as mastitis. So the benign form is more common, generally common in adults. The lesions are under tail. Usually we would able to see the lesions under tail, no systemic reactions. The goat pox, if you see the goat pox symptoms, clinical signs almost it is similar to sheep only, but you can expect the mortality going up to 90%. The papules may be present also on the tongue, rumen, kidney cortex, liver, and testicles. Large number of hot, pale, sometimes hemorrhagic lesions found throughout the lobes of the lungs are usually the most obvious signs and probably the most likely cause of the death. So usually the death happens due to hemorrhagic lesion found through the lobe in the lung. So that means because of the respiratory failure, we could able to see the mortality. All the body lymph nodes are enlarged. That is the usual things as it used to happen with the caseous lymphadenitis. But here also you can expect the lymph node swellings and maybe hemorrhage and contain micro abscesses sometimes. So this is the conditions being observed with the sheeppox in affected animals. See, sometimes so the sheeppox could be observed. So the breeds which are being reared for wool purposes. So once you shear the wool, you could able to see the pox lesions like this. So this is a severe form of sheeppox. Especially we could able to see this kind of infections in high altitude, especially Himalayas, Himachal Pradesh, Jammu Kashmir, like that. So diagnosis, so direct fluorescent antibody technique. So just we have to collect the edema fluid. If we have the monoclonal antibody, so we can go for direct fluorescent antibody technique. So that is like we used to use this technique for diagnosis of rabies. Then otherwise indirect fluorescent antibody technique. So in view of assessing the antibody status, or otherwise usually the electron microscopic or detects pox cells with inclusion bodies. If you want to grow, that means if you want to go for virus isolation of sheep pox, usually sheep testis cells, so lamb testis cells are being commonly used as a substrate for virus propagation as well as virus isolation. Treatment, normally for any viral infections, we have to think of using the palliative treatment with antibiotic ointment. So in view of arresting the secondary bacterial infections. Then if lesions are being observed in the muscle region as well as oral cavity, so then the laxative feed should be considered like porridge. Then so we can go for if dehydration is there, obviously we can prefer to give intravenous fluids. Fluid therapy can be considered. When you come to control and preventions, usually there is no effective treatment other than supportive therapy with antibiotics and fly control. Usually, if there is a chance to spread the virus through stomaxis, some kind of flies, the sepsi flies, especially sepsi, stomaxis will be of more prevalent nature in African countries compared to our Indian subcontinent. But still, so we have to think of giving supportive therapy with broad spectrum antibiotics in view of arresting the secondary bacterial infections. Then prevention countries free of sheeppox is directed towards prohibiting import of live sheep. Generally, so actually, as far as our country is concerned, it is endemic. But so when the country which is being considered of free of sheeppox, usually they have to go for prohibition of importation of live sheep or goats or the product from the pox endemic regions. Then prevention in endemic areas rely heavily on vaccination. Mostly, we have to think of vaccinated animals so that the population immunity will be achieved. So, in view of reducing the transmission dynamics of pathogens. So that's options. So that's the reason we used to go for mass immunization. The vaccine against sheeppox, like all other pox viruses, are live vaccines. That means still it produces lifelong immunity. So cell-mediated immunity. So people used to prefer to go for live attenuated vaccines. Almost even 10 hours also developed some sheep goatpox vaccines where we have gone up to even more than 80 passages in lamb kidney. That means testis cells. Then inactivated vaccines at best provide only short-term immunity. Suppose there is no option to get the live attenuated vaccines, then in such circumstances, we may go for inactivated also, but it is to yield only short-term immunity. The immunity is predominantly cell-mediated. Of course, all pox viruses, we need to have a cell-mediated immunity, but the humoral response appears to be of secondary importance, consequence of which that replicating antigen provides more effective immunogen. Attenuated vaccines issued in Kenya, they used to use the 0240 Kenya sheep and goat pox strain, which is being used in sheep and goat. Normally, the Romanian and RM65 strains used in sheep and in cattle. Whereas in India, so the Mysore strain and Gorgon strains are being commonly used in goats. Goat pox vaccines. Vaccines, sheep pox, live attendant vaccines should be given at 6 months of age. Whereas goat pox vaccines, it is also live attendant vaccines. It has been developed in Tanvas also, used for field use. You see, the vaccine has to be given at again at 6 months of age.